Good afternoon, everybody. My name is Scott McGann with the Falmouth Health Department, doing the February 4th, 2022 COVID-19 update. Our website is falmouthma.gov. Our email is health@falmouthma.gov, and our phone number is 508-495-7485. So our case count is 3,928 cases. These are PCR tests. These are not rapids, so they're not the home kits. So take that in mind when we give you the case counts, although it will tell you compared to other PCR weeks. The home kits are not trackable unless someone calls us to tell them they're positive. But we've always done PCR at the beginning, and it tells you an indicator of bad weeks and good weeks compared to yourselves. So there have been 83 confirmed cases during the week, 11 probables. Those are rapid antigens that do get reported. Those are such as Convenient MD. Those aren't home tests. Our 14-day incidence rate, which is what the population would be if it was 100,000 people in Falmouth, what our daily case count would be, it's between the 1116 and 1129. The state does it that way. It's the previous 2 full weeks. Last week I reported 96.2. We're down to 62.1, so it's captured some of the drop in the cases. So that number probably will continue to go down based on what I've seen since the 29th. And our 14-day positivity has dropped from 15.8 to 12.1. So still high, but on a right trend. If you look at our case counts to the far right, it indicates the spike that we just had. You can see that we had 1, 2, 3 really high weeks. It started to drop for the last 4. So we're under 100 cases. The spike seems to have subsided as quickly as it came. And so that's where we are with case count. So we're in a good trend. Again, it doesn't count home kits, but PCR has been pretty stable, the amount of PCRs we get, probably a little bit less, but than maybe earlier, because there's other methods such as the home kit, but nonetheless, it does indicate that the number of cases are dropping, so we're in better shape. If you look at PCR test, this is a number of cases plotted out every week. The flatter and more densely packed the circles are, the better we're doing. You can see like those last 3 or 4 weeks where we were really bad. You see it's really going vertically and separating from itself. Those are very bad weeks of high gains. And then you can start seeing the last 2 weeks, you can see where we're sort of flattening that this is the curve that we used to use in 2020, flattening the curve. But you can also see that they're tightly packed, so we had a better couple of weeks than we had previously. Same thing in the county. The spike up around 1,200, that's a 3-day case average, 1,200 cases in the county. 332 was the last full week. So that's a drop of 75%-ish, roughly, give or take. I'm just doing that in my head. So roughly, so it's a pretty good drop in the past week or two. So deaths now we're up in the last few. That's a lagging indicator. So the deaths would be these would be residual. These are from the original 2 weeks or 3 weeks prior. People generally in the hospital for a little bit, before they pass, unfortunately. But so that's where you see that number went up as a relation to, let's say back in, let's see, that was on the 27th. That would be from cases that were more like on the 8th or 9th or 10th, back when we were up in this area here, up higher. So that should start to trend back down. Still, nonetheless, a lot less cases. Again, we were seeing way more PCR, 3 times the amount of PCR, almost 3 times or so PCR tests positive, not counting home tests. We should have seen some number in here. Where this was in last year, 2021, in the teens, we might have been in the 20s or 30s for deaths, but because of Omicron being generally more upper respiratory, less likely to cause serious illness, plus a high vaccination rate and boosting is what's kept that from getting really out of hand for a number. Cases last week, right around the same time, were about 8,000 and change. Now we're at 4,829, so you can see the decline there. The decline everywhere, and you can see it in the chart next, which would show everything on a downward trend. So as fast as things went up, you see that same sort of spike in cases in the blue, similar to what you've seen in Falmouth. Positivity is dropping. It's dropping in Falmouth. Deaths are dropping. It didn't really get up proportionate to the number of cases. Again, vaccinations and Omicron being generally a little less than Delta as far as severity. And again, hospitalizations down. Still higher numbers than we'd like to see, but at least they're in a good trend. At least they can report that the trend is good. Hospitalizations, 6 and 2, which is better than the week prior, which was 14 and 5. The week before that, 12 and 3. This is Falmouth Hospital. In terms of all cases, 60 and 12, 65 and 7, 57 and 10, down to 38 and 4. So you can see the cases go down, so on hospitalizations. The highest our number of ICU, percentage of ICU beds occupied, as highest was 15%, back down to 10. I'd like to see that keep trending in the right direction. In similar numbers to what we saw, these are last year's 2021 hospitalization rates. So we sort of were a bit higher, but not proportionately higher than what, based on the number of cases. So our caseload went way up, but the hospitalizations did not go up at the same proportion, again, because of vaccines, boosting, and Omicron being a slightly different than the original COVID, which would have been original COVID, or anything that happened with Delta since about July. These are incidence rates. This is adjusted for population, so this is what the incidence rates would be if all these towns it was all based on 100,000. So Falmouth is in the middle at 62 daily cases, if the population was 100,000, which means you divide this roughly by 3, because we have about 33,000 people in town, which would give us somewhere around 20 cases per day. And we're sort of in the middle. The state would have been, that same time period, averaged 110 cases per 100,000. And so we've done better than the state, and it looks like we've done better than most towns, especially the Upper Cape towns and Mid Cape towns. Yes, we have. And we typically do better, I would say, than towns similar to our size. And in terms of positivity, sort of right, again, the same, 12.15, a little higher than what the state would have been at 10.06. Better than Barnstable, Bourne, Dennis, not as good as Provincetown, Eastham, Truro, so sort of in the middle. Again, I find this to be a very important chart. This is sort of bottomed out a little bit. 422,132 breakthrough cases, 6,440 hospitalizations, or 1.53. It was 1.4 something, so I think it sort of bottomed out. It was dropping a lot. Because Omicron and boosting creates less hospitalizations. And so of all people that have had a breakthrough case, 1.53% hospitalization and a death rate of under 1% at 0.42%. On the far right is just basically 8.1% of all vaccinated people have had a breakthrough case, and well under 1% have been hospitalized. That's entire population. Sorry, this is percent of all fully vaccinated, 8.1%. Of all fully vaccinated individuals. So 8.1% of all fully vaccinated people have gotten COVID. And if all the vaccinated people, it would be under 1% hospitalization. Of those that got COVID, that's with a 1.53. So you're very unlikely to be hospitalized if you've been vaxxed, and especially if you've been boosted, and also of death as well. So again, this is just a push for vaccinations. Our vaccinations are, we gave out 327 first, second, and booster doses over the week. We're at about 95.5 of all eligible residents have had at least one dose, and 83.5 of all eligible residents have gotten fully vaccinated. So again, we're making dribs and drabs, but we're making some gains, and so that's kind of where we are with vaccinations. We've always been pretty strong uptake in the town. Vaccine eligibility, again, didn't fill the clinic that I had. Also, the school clinics have not had as many takers. I think we've sort of saturated with vaccines. I think there's plenty to have. And I think people that have made the decision to be vaccinated have. But again, going back up, you did have 67 people decide to get their first dose. So you're still getting some increases, But I think most people that have wanted it have had an opportunity to get it. Where do you get it? Pharmacies, community MD, community health centers, Barnstable County Health Office, Cape Cod Community College was doing Sundays 12 to 6, Tuesdays and Thursdays 8:30 to 2:30. You can get both that on the Barnstable County's website. We did one at the Gus Caney. We'll do another one, I think, but again, we didn't fill it up, and I'd rather do it if there's a need. If there's just as easy to get it from a pharmacy, just assume you get it there because they're all set up for it. Where do you find this all? The vaxfinder.mass.gov. Again, there should be plenty around. If you're having, you shouldn't have trouble with it. The clinics are not being sold, not getting too full at this point. Homebound people, those that are homebound, if you know someone who's homebound, you should call the health department directly. We can have the VNA do a home visit to come out and do a vaccination. Have that services in there now since probably April or so, March or April of last year. Booster doses, again, this is right off this CDC, 12 and older for Pfizer for booster, 18 and older for Moderna and Johnson & Johnson. Again, booster shots are good. They'll definitely help you. There's actually talk of fourth boosters eventually down the line for those that are very immune compromised. I don't have anything definite for that. Testing hasn't really changed much. You have the home kits. You have the Stop the Spread site at the state. Down the bottom, I got the Melody tent to stop the spread. You have home tests. You have, the Convenient MD has always been really big in CVS. You still have that. The Test and Stay program at the school is being replaced with a pool testing and home kits. It's just a bear to do. Schools aren't testing facilities, they're education facilities, but they had to make them into testing facilities, the way Test and Stay was. And I think a lot of towns, municipalities couldn't handle it, so they switched it over. And plus, you were getting like 1.5% or so positive, so you're doing a lot of testing and not finding a lot. Percentage of the amount of testing. Fairgrounds, again, you can, the Cape Cod Church is going to be the spot instead of the fairgrounds. It's going to be run by Barnstable County Health. Falmouth Hospital still has their system going. Again, so there should be ample opportunity to get tested. Nothing's changed with isolation and quarantine guidance. Again, if you're the only way they consider you fully vaccinated is if you've been boosted. That's the only time you would not have to quarantine. If you've only been vaccinated but not boosted, you should stay home for 5 days. Test on day 5 if possible. And so or definitely if you've not been vaccinated. So they treat the non-boosted and unvaccinated the same when it comes to quarantine. Stay home for 5 days. Okay, if you don't develop any symptoms, and continue to wear a mask for 10 days, and test on day 5 if possible. If you do have it, you're out for at least 5 days. Symptoms have to resolve substantially. If you still have a fever, you should still stay home. And then wear a mask for an additional 5 days. So nothing's changed on that. You can access your vaccination records at myvaxrecords.mass.gov. Again, just do it on the website. This is what it looks like. I think this is page 1, and then when you click on Find My Record, this Access My Vaccination Record, the right-hand side will show up. Omicron is 100%, just about as close, 99.9 to 100% is as close they're going to show it. So we're all Omicron, which is definitely better than Delta, I think. It's outcompeted Delta. There is another, son of Omicron out there. I haven't seen that it's done anything special at this point, subject to change. The boosting and the vaccinations definitely help, and it definitely produces less severe outcomes, but it definitely causes more cases. So you get more cases, generally more mild on the by and large, and that's why the hospitalizations didn't get out of control and the deaths didn't get out of control comparatively to the amount of cases, was because, again, boosting and vaccinating, boosting, and the fact of Omicron itself. So nothing really new to add to that. It took over pretty quick. Took about, as soon as it started showing up, 1, 2, 3, 4, 5, 6, by 7 weeks it was just about 100%. By 5 and 6 weeks, it was like 90 plus. So it's pretty fast on how that. And how it's shown is the orange was Delta, time goes from left to right, and then the purple is when Omicron showed up. So it just started to really show up 12.4 in small percentage. By 12.4, by 1.4, it was pretty much all of it. So that's pretty quick. Pretty amazing, actually. Still at a mask advisory everywhere but schools. That's required still, I think, to sometime in February. And also the select board on 1/11/22 adopted a mask requirement town-owned properties. So town-owned properties indoors, schools, and that's really it. The rest is a strong advisory asking you to wear masks indoors. As far as our metrics, we're still considered high. We're getting better on positivity. Maybe next week, if we drop under 10, we might go to substantial. It's going to take still a little bit more time to get down to substantial and moderate for our incidence rate. Okay, but the good news is the hospitalizations dropped by roughly half or so, a little bit more than half over the past week. Hopefully continues, and then our vaccination rates are strong. So these are the things you look at when you think about mitigation, and so that's where we are with that. Recap, case counts are still high, but definitely dropped under 100 and definitely have tapered off, as I showed you in that chart. All the cases are Omicron right now. Face coverings are urged, especially, what's your vaccine status, your health conditions, making the good decisions. Vaccine eligibilities is there, the booster shots are there. There should be plenty of opportunity to get a test or if you're vaccinated. I think even getting home kits is sort of loosened up. And so, right now that's where we are, sort of a holding pattern to see that Omicron tapers off. Hopefully we have a very good, continuation of that. And then if it stays low and continues low throughout the winter, it's strong to suggest it'll probably continue into the summer. Usually it's the winter time that we worry about respiratory viruses. So we had even in 2020 and 2021, we had low case counts in the summertime. So let's just, I'll give you another report again next week like we always do on Fridays, and everybody take care. Thanks.